The World Health Organization says an estimated 5 to 10 million people die annually from kidney disease across the world. In Nigeria, the country's Association of Nephrology said most people who suffer kidney failure cannot afford transplants or treatments. Health advocates are using this year's World Kidney Day to sensitize people on kidney disease and prevention. Here's CGTN's Ihaza.
Ijeoma Oponwa is a survivor of kidney disease. She now lends her voice to helping other kidney failure patients in Nigeria. After being diagnosed with kidney failure in 2014, it took Ijeoma 2 years to raise the funds required to do a kidney transplant.
I was on dialysis till 2015. When family and friends came along, they helped raise funds for me to get a transplant. So I left for India 2015. October. With a non-related donor, we went together to India, and I finally got a kidney transplant January 2016, and I'm doing perfectly okay.
The Nigerian Association of Nephrology says at least 20 million Nigerians have kidney diseases. That's at least 10% of the country's population. Dr. Fatima Bello is a nephrologist at the National Hospital, Abuja. She says there are multiple factors causing kidney diseases in Nigeria, apart from excessive consumption of alcohol and smoking.
The commonest risk factor here in Nigeria is hypertension and chronic glomerulonephritis, and others are diabetes and mellitus, and other risk factors are from drugs. People take, taking chronic painkillers for pain reliefs, like cataflam and ibuprofen, and it could also be from drugs, herbal medication use from herbal drugs, and there is also implication of toxic and heavy metal use, like mercury, lead, and cadmium.
According to the Nigerian Medical Association, the country faces a shortage of trained health workers needed to cater for diseases such as this. It costs around $27,000 to carry out a kidney transplant in Nigeria, and with the high number of cases, many patients prefer to travel outside the country to get treated. But nearly half of the country's population lives in extreme poverty and cannot pay for treatment either at home or abroad. Experts say the government will need to do more to assist kidney patients in the country.
The limitations to kidney transplantation in Nigeria involves financial constraint on the part of the people affected and the costs of renal transplantation. And even though I think we have the expertise and the facilities here in Nigeria, there is need for legislation for the government to subsidize the costs of renal transplantation for the population to be able to benefit from transplantation.
Non-governmental organizations and health practitioners in Abuja are raising awareness on how best to prevent kidney failures and detect early signs and symptoms of the disease. Free tests and screenings are also carried out.
Lawmakers are putting together a health insurance bill that seeks to reduce the cost of medical treatment for citizens across the country. The law is expected to be ratified this year. For now, more exercises like this could help reduce the prevalence of kidney diseases in Nigeria. Ihaza, CGTN, Abuja.